Hi, thank you for joining us, Chance, for another Prep Advocates Unleashed, a new series from Prep for All, where we talk to Prep users and advocates from around the country to talk about the benefits of Prep, challenges to access, and how we can overcome those challenges. So, thank you for joining us. And just going to jump right in. Tell us, how did you first learn about Prep and what made you decide to get on it?
So I learned about prep through some friends, probably 10-ish years ago. Prep was still relatively new at that point, especially in the deep south where I'm at. It was still kind of making its way around. And at that point, honestly, it didn't have the best, I guess, reputation. We were still in that point where people were talking about, oh, you only take it if you're promiscuous or those type of things. So that was probably the first time, as probably about 10 years ago. When Truvada started spreading around and all of that, and at that point, I don't even think there was a doctor in our area that would prescribe it.
And in your area, you're talking about Alabama, correct?
Correct. Coastal Alabama at that.
Yeah, and I'm based in Atlanta from Louisiana, so I definitely know like navigating different environments. I definitely working in Atlanta doing direct service and linking people to prep services. We would have people who would come from as far as Alabama, as far as like South Carolina, other parts of rural Georgia, just because we know that you have a lot of providers who are just not knowledgeable, or if they're knowledgeable, they may not have the resources like a prep navigator to help people navigate like medication assistance programs and other resources to make prep easily available.
So at that point, well, actually, about a year after that, I looked into actually starting prep, and the closest place that I could access it at that point was New Orleans.
Wow. From Alabama?
hmm
Wow.
Which for me, that's only about an hour and a half, 2 hour drive. It's not terrible, but I mean, that's still, two states over technically.
Right. And not everybody has the resources to get to or time to get to states over as well.
Absolutely.
So what made you like what were some of the benefits for prep for you when you decided to start?
So when I decided to start prep, it's actually a couple of years after that I'd finally gotten health insurance, so that was one factor. The second, at that point, I was a couple of years into a serodiscordant relationship, and while we know U equals U, undetectable equals untransmittable, and we knew he was undetectable, we hadn't had any issues with that. We just wanted that extra layer. That's as I always put it, you still wear your seatbelt even though you've got airbags.
Right.
Uh, and then on top of that, I'd also started working in HIV prevention, and I wanted to be someone who, when I was talking to other people about PrEP, that I could say, "Hey, yeah, I've taken this as well."
Right. So when you the work that you do with AIDS Alabama, mind telling us a little bit about what you do and how you help people access these services?
So I am director of prevention, education, and outreach. And this is my third role with the agency. I started almost 6 years ago as our prevention, education, and outreach coordinator, which that's the person that actually goes out into the field and does presentations and education. At that point, I was also doing HIV testing in the field. We had a little van that we would take places and we'd offer HIV testing. It was the rapid testing from INSTI at that point. Um, I would do tabling at events. I would also do educational presentations for providers or facilities, anywhere that felt they may come into contact with people living with HIV or at risk. And I would go and do that type of education. From there, when we started our Ending the HIV Epidemic initiative in 2021, I became the coordinator for that. And that helped us start and expand our clinic, Shell Health Services. Shell Health Services is the only dedicated PrEP clinic in Southwest Alabama. We started at 4 hours a week on Tuesday evenings. just doing PrEP. From there, we expanded to doing HIV treatment as well. Um, about midway through 2021, when we found some additional funding, we expanded to full time, 40 hours a week. Um, and then we also brought on a nurse practitioner full time at that point, and started expanding the scope of that clinic, doing STI testing and treatment, Hep C testing and treatment, of course, HIV testing, PrEP services, and treatment services. Um, with that, when we started expanding it, our goal was to make sure that there were as few barriers as possible. And one of the biggest ones we've seen down here is cost.
Mm,
Um, so when we started it, and actually to this day, that clinic does not charge. We don't have the capability to. We're not set up to. Um, we don't accept insurance, anything like that. We're completely grant funded. But anyone can come in regardless of income, insurance status, station, anything like that. They can be seen, they can get the services they need, they can get access to PrEP. For the medication, we send that out to a pharmacy, and there may be a cost associated with that, but we always try and make sure if we can help with that cost, we will. A lot of times that means patient assistance programs or copay assistance, helping them navigate those type of things that we do as well. And it's worked out great.
right. And, oftentimes when we see, PrEP has been around, you said you were an early adopter to PrEP, and we definitely see a lot of communities left out. Oftentimes we see challenges for young people. We see challenges for both cis women and trans individuals. And another community that's often not talked about are people who inject drugs. With the work that you do in Alabama, what are some challenges you see to that population, and what are some of the work that you do to better reach and make PrEP accessible to that population?
So that's a population that's kind of near and dear to my heart. I am about 10 and a half years in recovery. April, it was actually 10 years in recovery from IV, morphine, and heroin drug use. Um, so it's kind of a been there, done that type of thing for me. And having been part of that community, having lived that life, you know, it becomes hard to reach those folks because nobody wants to admit to it. Nobody wants to talk about it. You
Mhm.
know, even amongst other people who also use, you often downplay, your use or what you're actually doing, that type of thing. So it becomes really hard to reach them. And one of the things that I found is, essentially using my story, once I start talking about it and once I start saying, hey, I've been there, when I was doing that education early on in my first role here, I used to joke when we were going through the risk questions, that if there was a question on here that, did you shoot heroin in a back alley using rainwater? I would have had to been like, yes. And it kind of got people to chuckle, but it also kind of got them to open up and be like, okay, well, I'm not the only one, let's talk about this. Um, and at the time that I was using, honestly, I don't know how I didn't come in contact with the virus. I had multiple friends through that time period that contracted HIV, that contracted Hep C, and somehow I came out unscathed. And while I'm not a very religious person, I definitely think there's a reason behind that. Um, so that kind of pushed me to reach that community, but it means going into a lot of places you wouldn't think we'd go to.
Right.
We spend a lot of times in rehab, a lot of time in rehabs, in sober living facilities, in reaching out to people who have left those facilities, both good and bad terms. And honestly, sometimes the ones that have left under bad terms are the higher priority because they're the ones that are more likely to be out there using and to need our services. Um, and so it's kind of networking through the grapevine essentially, of talking to people who are recently coming out, finding their former friends, finding their former acquaintances, their dealers, um we've also started reaching that community by providing free Narcan and free fentanyl testing strips. That's something that anytime we table, anytime we go anywhere, do presentations, we have that with us to give out. No questions asked. And then we also have a vending machine at our location that people have 24-hour access to. That's got free Narcan. It's got free the fentanyl testing strips. It's also got test my drink strips to test for roofies, things like that, that people
Wow.
can access more or less anonymously in order to be able to get that in. It's got information about our clinic, about what we do, all of that type of stuff with it as well.
Wow. So just really taking a people-centered approach, a holistic approach, really meeting people's needs and meeting them where they are. It's inspiring to hear you say that because I know as someone who's gone out in the community and talked with about PrEP and educated people, I've gotten pushback, because I've heard providers and organizations say, well, first we want to focus on getting someone sober and then getting them on PrEP, because which makes no sense because PrEP is a harm reduction approach. People who
Right.
are not ready to make that change still deserve resources to reduce their harm.
Oftentimes, by the time you get someone sober, they may not necessarily need PrEP anymore. And our idea, and thankfully our providers are on board with this, our staff are all on board with this, is a harm reduction approach of, we may not be able to get you sober the first time we see you or get you linked into a facility or something, but let's give you what you need to kind of lessen that risk, to lessen that harm. If that means making sure you've got fentanyl test strips or making sure you've got, PrEP or whatever like that, we're going to do it. Um, and thankfully, we've got a pretty good community around us as well that leans into that that can help spread that word as well. One of the things that makes that difficult with harm reduction in Alabama is a lot of it's not legal.
Right.
Uh, it's not legal for syringe exchanges here, for needle exchange programs. It just became legal a few years ago for fentanyl test strips. And so there's a lot that we just can't do. So it became tricky to kind of thread that line of what can we do, what can't we do.
Right. So, and you said, so, want to go back. You said that the services you provide are because you are grant funded. Right now, we know we're in challenging political times, and there are threats to a lot of the resources that help people not only access PrEP, but access other services like housing and SNAP benefits and things like that. So with all of these emerging threats going on, how would that impact the communities that you serve in your work when it comes to accessing PrEP and other HIV prevention resources?
So thankfully, so far, we haven't seen any impact to our funding or our services directly. Um, we're absolutely anticipating some, but so far, knock on wood, we haven't. What we are worried about is a lot of our communities that we serve are dependent on these wraparound services, be it SNAP assistance, be it Section 8, anything like that. And a lot of times if they lose access to those programs, to those support services, the first place they're going to turn is survival sex.
Right.
Whether it be, for money directly, for food, for a place to stay, things like that. And with that comes a significant risk in the chance for HIV. Um, and so that's one thing that we're watching and making sure we know, these communities have access to it, making sure that we're getting out there and getting the word out to them, and especially in a non-judgmental way. A lot of people, when they turn to survival sex, there's a lot of shame in it.
Hmm.
And it's something that, you know, we it's difficult to tell people, oh, you shouldn't feel shame for that. But, you know, getting that word out and letting them know, we don't care why. We don't care what you're doing. We just want to take care of you. And that's kind of that approach with all of it, with the drug use, with, survival sex, with anything like that. Letting them know, look, we just want to take care of you. We need to know what you're doing so we can care better. A lot of times, and our providers are on board with this, if there's, what we consider extraneous information, what their risk factors are, we're not going to document them because we know, they a lot of times people fear that. We'll just document they are at risk, but not why. And we let them know that. And then a lot of times that'll put them a little bit at ease too. But that's what we're really anticipating, and thankfully we are getting out into those communities more. We're starting to do a lot more with housing organizations, with organizations that, food banks, things like that, because we know this is going to be the population that's going to start emerging as these cuts come into play, and as these shifts happen, that they're going to be at higher risk.
Right. And so some of the work that Prep for All has done, along with many of our partner organizations and over 100 supporting organizations, is advocating for a federally funded national Prep program. And much of what you touched on are things that we've advocated for, including, making sure that we're addressing coverage barriers for people who are uninsured and underinsured. Also, those community-led campaigns, what works for one community or works in one region may not work for another community or another region. You talked about, one way of reaching people is through those like community networks. Looking at, we also also looking at implementing telehealth and provider expansion and educating providers. And as we continue to engage more and more communities, these are the things that our people are telling us, hey, this is what we need. This, we have to go above and beyond. We can't just use the status quo model of hoping people show up to the clinic and, have the resources that they need to be able to access PrEP. So how would things like telehealth or making sure that you have telehealth access, say, in rehab facilities or harm reduction organizations or homeless shelters and domestic violence shelters, making sure we're offering PrEP in those non-traditional spaces and making it in a way that regardless of what local resources exist, if you have a national program that could cover those coverage barriers. How would a robust program such as that be able to help your community that you serve?
So it would definitely make it easier. For our organization, we serve 12 counties in Southwest Alabama. It's almost 13,000 square miles. It's a lot of space. In that, there's almost 2 million people. And I have an outreach team of 7.
Wow.
Um, so anything that can help with telehealth, with resources like that, with non-traditional access, that's going to benefit us, especially if those networks are already kind of in place and we don't have to build them from scratch. That
Exactly.
means I can dedicate less resources to building the network and more to utilizing it. Um, that's one of those things I always tell people: if you've got to build the boat, you're not going to spend as much time on it. Um, so that's one thing we're looking into is utilizing those, and we've kind of been we have been building our own, to be honest. We've got 2 clinical units. They're clinical RVs that will go out into the field with an outreach worker and a medical assistant, and then link back to our providers that are in house in our brick and mortar location. And they'll provide testing, they'll provide PrEP services, treatment services, all of that. Another way that we've kind of leveraged what we've already got is our lab services company has satellite draw sites that allow us, we can put the orders in the system, and then let our patients know, hey, you can pop up at any one of these places, or you can go to this website, put in your zip code, it'll tell you what's close. And doing teleprep that way, where they'll reach out to us, they'll see our provider through either a phone call, a Zoom call, something like that, and then we'll send them out to that lab provider wherever they happen to be, so that they can get the blood work done, all of that type of stuff, and remove those barriers. Because as I said, in those 12 counties we serve, we're the only PrEP clinic. The next closest place with a PrEP clinic is actually halfway to Atlanta. Is going to be Montgomery. So that's a lot of distance to cover. And with 10 of those 12 counties being extremely rural, um, a lot of them have high poverty rates. They have low access to medical care and doctors. When I was doing some research last year, I found out two of those counties only have one primary care physician in the entire county. Um, so those things like telehealth become even more vital when there's not even access to regular, traditional health care, let alone PrEP access or HIV care or anything. With the rollout of national models where it's standardized, it'll make it significantly easier for us to care for those folks, and it'll also make it easier to for us transition those folks to, if they, let's say they move to another area, if there's some sort of national model that we can go through, it'll make it easier to kind of transfer that care, and it'll make it easier on them because they're going to know what to expect.
Thank you. It sounds like you're doing like really amazing work in your region. It sounds like you have a small team doing a heavy lift. So thank you for all of the hard work that you're doing. And I know your community really appreciates it. If someone were interested in your services, how could they get in contact to utilize the great services at AIDS Alabama?
So I would suggest either reaching out to us through our website or through our Facebook. We have two websites and two Facebooks. One is under AIDS Alabama South. You can go to aidsalabama.south.org or AIDS Alabama South on Facebook. The other is strictly for our clinic. It's Shell Health. And you can go to shellhealth.org or Shell Health on Facebook. You can reach out to us through any of those. If you send an email through the website or send a message through the Facebook, our team will get those, and we typically reply to them pretty quick. And we can get you linked with any of our services that you need, whether it be prevention, whether it be treatment, whether it be education for you or your partner or your coworkers, anything like that. And if it's outside of our wheelhouse or our service area, we'll help you find out who can get you those services.
Thank you so, so much. And if you also want to see more PrEP Advocates Unleash videos and learn more about the work that PrEP for All is doing to advocate for a federally funded national PrEP program, you can go to prepforall.org/PrEP saves. Thank you so much, Chance, for joining us today.
Absolutely. Thank you for having me.